Hello, and welcome to What's Up Oxford. I'm Shannon Woolley, and today I'm here with Zachary Hollingham, and you are the Director of Clinic and Client Services with Oxford County Community Health Centre.
Yes.
That's a mouthful. Welcome to the show.
It is. Thanks so much, Shannon, for having me.
So what is the Oxford County Community Health Centre? What do you guys offer?
So we offer a wide variety of programs and services that are meant to support people who are experiencing kind of multiple life challenges on their path towards kind of health and well-being. So some of the challenges that folks we help might be facing are things like substance use disorder, addiction, people experiencing precarious housing or housing instability or homelessness, people who don't have access to oral health care, individuals with chronic mental health or physical health conditions, those who might have been victims of sexual assault or domestic abuse. So our services, you can see, really kind of wrap around the individual wherever they are in their journey to try to help them with all those little elements of what make someone healthy and happy.
Okay. And have you noticed a significant uptick in the needs since, the COVID-19? I know that in some other people I've spoken to, they've mentioned that, mental health has really suffered in the last few years, as well as obviously financial health is starting to you can't turn on the news without hearing about interest rates and housing market and lack of housing. And have you guys noticed that there's been a significant need?
Totally, Shannon. Yeah, two things come to mind right away. Our mental health counseling and substance use counseling teams have seen a huge increase, unfortunately, in the demand for services. A lot of individuals are really struggling because of all those factors that you talked about. Economic, social, post-pandemic, et cetera. And the second being housing. So we're seeing, obviously, the cost of housing with inflation and all the other pressures has just gone through the roof. And so folks are struggling with, either being at risk of being evicted or having trouble finding housing and ended up being either precariously housed or unhoused. Those are kind of the two main things, but they're definitely, again, everything's all connected together. So all those aspects influence one's overall kind of health and well-being, and that's where we're here to help.
Of course. Okay. So what would differentiate you from your organization from other services being offered?
That's a really great question. I think traditionally as a society, we might see medical care and health very narrowly. Something happens, you go to see your doctor, they either address the issue or they refer you to a specialist, so another doctor, and then that's kind of the extent of it. Where we really differentiate ourselves is that we address, I think intuitively all know that there's many different aspects of one's day-to-day life that impact our health, and we try to recognize and address all those different factors. So kind of emotional factors, as we've talked about, housing factors, access to basic supplies, mental health considerations, chronic disease considerations, even oral health care. So we have a new community dental clinic that provides oral health care for those who don't have access to it. So I think it's really seeing all aspects of the individual and trying to address as many as we can to the ultimate outcome of them feeling happy and healthy.
Okay. So if there is somebody watching that knows somebody that may be, or somebody that's watching that could maybe benefit from these services, how do they go about getting help with housing or mental health or your dental services that you offer?
One of the big things that we try to focus on is being low barrier, and so we don't worry about having our pathways into our programs being too complex. So there's two simple ways you can get a hold of us. One, give us a shout at 519-539-1111, or alternately you can email info@oxchc.ca. That's info@oxchc.ca. Those come directly to me, and I'll get them where they need to go. There's no wrong door with us. Just give us a shout, shoot us an email. We can give you an overview, one of our outreach workers, of what our programs and services look like, what might work for you, and get you connected as easily as possible.
Okay. And then there's no need for like a referral from, let's say, like Children's Aid or a doctor or anything else anybody can contact?
Yeah, great question. Anyone can reach out. Our programs don't often require a formal referral from a healthcare provider, and you can refer yourself essentially. But if in the case that they do, we'll get you hooked up with a form and support you in getting it completed. Again, in keeping with our idea of lowering barriers to care.
Okay. How can we get this message out to more people that we are seeing on the streets? I mean, I drive to the gym in the morning. It's 5 o'clock in the morning, and there's people outside sleeping. How do we get that message out to them?
Yeah,
my heart breaks when I see that. By the way, it's just gut-wrenching.
So do ours, and those of our passionate staff as well. One of the things that we've done that was kind of came to be during the pandemic is our mobile health outreach bus program. So that takes services, social services, as well as nursing services out to the street, into community, to meet people where they are, at shelter, in encampments, downtown, at various locations. So that's one way that we're trying to kind of get to those folks who have a hard time accessing traditional services.
Right.
And then otherwise, I think viewers of the show or yourselves, you can simply spread the word. Spread the word. Whatever you heard from me today, whatever your experience has been with our programs and services, let folks know that exists, that might benefit from them, and let them know that we're here to help.
All right. Well, thank you very much for being on the show today.
No problem.
We're going to take a short break. We'll be right back.